That's right, Christine. This report is being compared to the landmark Surgeon General's report on tobacco more than 50 years ago. It seeks to have all addiction, alcohol, prescription drugs, heroin, and other opioids treated as a chronic disease, just like heart disease, diabetes, or cancer. The addiction epidemic is widespread and an equal opportunity destroyer of lives. From young people on Long Island to affluent neighborhoods in Westchester to the suburbs of New Jersey, opioid abuse is taking the lives of far too many of our young people.
It is the nightmare that nobody ever wanted to live.
It is that kind of tragedy that led Dr. Vivek Murthy, the U.S. Surgeon General, to produce a groundbreaking report on addiction in America, calling it the most pressing public health challenge of our time. More people suffer from a substance abuse disorder than the number of all patients with cancer combined. Yet,
only 1 in 10 people receives treatment. In addition, 1 in 7 people in the United States is expected to develop a substance use disorder at some point in their lives.
According to Dr. Murthy, the biggest obstacle to stopping the epidemic is the way we think of addiction.
We have to recognize that addiction is not a moral failing. It's a chronic illness that must be treated with skill, urgency, and compassion. We know how to solve this problem. Prevention works, treatment is effective, and recovery is possible for everyone.
Addiction experts like Dr. Paul Rinaldi of Mount Sinai West agree with Dr. Murthy that treatment programs that combine medication and counseling are effective and actually save money when all the costs of addiction are added up.
Homelessness, crime, loss of productivity, and high utilization of healthcare services. We're paying for this anyway. We're just paying for it in the wrong way.
Now, Dr. Rinaldi and others say the Affordable Care Act, Obamacare, has actually helped with addiction treatment because it puts addiction and other mental health problems on the same level as medical problems, requiring that lifetime caps for treatment be the same for physical and mental issues. But the point they really are making is we have to take the stigma away from addiction in order to get people into treatment and prevention programs.
Serious, and we should point out that 78 people die a day from opioid abuse, which is unbelievable.
Huge problem.
Right.
Thank you, Dr.
You bet.